Imagine if I told you that 3 days before a stroke strikes, your heart is already sending out a warning signal. It's a signal so specific and unmistakable that if you know how to spot it, you could actually stop a stroke before it takes place. And what if I told you that the majority of folks over 60 who suffer strokes experience these very same warning signs in the days leading up to it, but they either ignored them or just had no idea what they meant? My name is Dr. Eduardo Perez Alba. Throughout my years of studying cardiovascular and neurological health, I've watched this exact pattern play out more times than I can count. I've met with patients who came to me after suffering a stroke, as well as family members of those who tragically didn't survive. When we looked back and walked through the days right before it happened, the warning signs were consistently present. They were undeniably there. The heart was calling out, the body was practically screaming, but nobody knew how to listen. That changes right now, because over the course of this video, I'm going to walk you through every single thing your heart tries to communicate during those 3 critical days before a stroke. We're going to cover the physical indicators, the neurological signs, and the noticeable shifts in your sleep, vision, speech, balance, and even your emotional state. I'll break down precisely why these changes happen, what's taking place deep inside your body when they occur, and the exact steps you need to take the second you spot any of them. Make sure to watch this video all the way through, because each section connects directly to the next, and the details in the second half are every bit as vital as what I'm sharing at the start. Stick with me on this. It could easily be the most crucial video you ever watch for your own health or for the well-being of someone you care about deeply. Let me kick things off by making sure you truly grasp what a stroke actually is. Most people only have a broad, hazy concept of it. They understand it's an event that takes place inside the brain, and they know it can be fatal or life-altering, but they don't really get the underlying mechanism. Once you comprehend that mechanism, all of these warning signs start making complete, logical sense. A stroke happens when blood supply to a section of your brain gets cut off by a blockage, or when a blood vessel inside the brain bursts open. The moment brain cells are deprived of oxygen-rich blood, they start dying off within minutes. In fact, in just 4 to 6 minutes, billions of neurons can suffer irreversible destruction. There are 2 primary forms: ischemic strokes, which make up roughly 87% of cases and occur when a clot obstructs an artery in the brain, and hemorrhagic strokes, which happen when a ruptured blood vessel leaks directly into brain tissue. Now here's the part that most folks completely overlook. The vast majority of strokes don't simply strike out of the blue. They're actually preceded by a stretch of cardiovascular instability, arterial pressure, and neurological disturbance that can stretch on for days. Your body isn't staying silent through this period. It's being loud. It is frantically attempting to adapt and compensate for the breakdown happening inside. As it tries to adjust, it broadcasts clear physical, sensory, emotional, and behavioral signals that, if you catch them, grant you a crucial window of opportunity to step in, seek medical help, and potentially save a life. I want to focus specifically on the role your heart plays, because people frequently treat cardiac health and stroke risk as separate issues, which is a dangerous misstep. Your heart and brain maintain continuous communication via the vascular system. Anything taking place in your heart directly impacts the oxygenated blood reaching your brain. Whenever your heart comes under strain, when its rhythm falters, when its pumping capacity declines, or when microscopic clots form inside its chambers, your brain is the very first organ to suffer the fallout. One of the biggest cardiovascular risk factors for a stroke is a disorder known as atrial fibrillation, commonly referred to as AFib. During AFib, the upper chambers of your heart flutter chaotically and irregularly rather than beating in a steady, synchronized rhythm. That irregular motion allows blood to pool and sit still inside the heart's chambers, and stationary blood rapidly forms clots. Those clots can then break free, journeying from the heart up through the carotid arteries directly into the brain, where they choke off circulation and trigger a stroke. What makes AFib particularly treacherous is that it frequently comes and goes. It might last for brief minutes or several hours without triggering any obvious, dramatic warning signs. Millions of adults over 60 live with AFib without having any idea they have it. They might experience an occasional flutter, a subtle sensation in their chest, or absolutely nothing whatsoever. Yet, in the 3 days preceding a stroke, AFib episodes regularly become more frequent, last longer, and grow much more intense. So, one of the very first warning signs your heart provides in those 72 hours is a shift in its baseline rhythm. And recognizing that shift gives you an early advantage that most people overlook completely. During the 3 days leading up to a stroke, many individuals start experiencing a distinct form of fatigue. This isn't typical tiredness caused by a hectic day or a rough night of sleep. It's a deep, heavy, cellular level of exhaustion. It's the type of fatigue where your physical body feels like it's grinding away just to keep basic operations going. Because it literally is. When your cardiovascular framework is straining and blood delivery is falling short, your body reallocates energy away from non-essential tasks to keep critical organs functioning. Your muscle tissue receives less oxygen, cellular energy production drops, and the end result is a profound, unexplainable sense of drain. Countless stroke survivors recall this sensation in the days prior as a crushing heaviness unlike anything they'd ever felt before. It's an overwhelming fatigue that feels completely illogical based on how much rest they'd gotten. Others describe it as trying to move through thick water or heavy air, where even basic daily tasks demand immense physical effort. This isn't laziness, and it isn't just mood-related. This is your physical body actively diverting vital resources to handle a building cardiovascular crisis right under the surface. Right alongside this profound fatigue, many individuals develop a very distinct type of headache in those pre-stroke days. This pain stands apart from standard tension headaches or typical migraines. It usually concentrates at the base of the skull near the back of the head, presenting as an intense pressure or a throbbing tightness from within. In hemorrhagic strokes, the pain at the exact moment of rupture is famously remembered as the worst headache imaginable, a sudden, violent thunderclap of absolute agony. But in the days prior, the headaches are often more subtle and gradually building. They might fluctuate, feel sharper upon waking, or come paired with neck stiffness and light sensitivity. These pre-stroke headaches stem directly from surging vascular pressure and localized inflammation developing within the arterial pathways that feed your brain. Whenever you experience a headache that feels noticeably different from your regular pattern, especially if it sits near the base of the skull, steadily escalates over a few days, or arrives alongside other subtle neurological shifts, that is a critical signal that warrants immediate emergency medical evaluation. Now, let me highlight one of the most overlooked pre-stroke indicators of all, one that's particularly vital for adults over 60 because it gets brushed off so easily. In the days before a stroke occurs, many individuals experience sudden, temporary shifts in their eyesight. These shifts can manifest in several ways. Some describe a brief dimming or blurring in a single eye, akin to a shade or curtain dropping over part of their line of sight. Others report seeing flashes of light, unusual shapes, or a sudden struggle to focus visually. Still others experience double vision for a brief moment before it clears right back up. And because these fleeting episodes might only last a few seconds or minutes, people routinely brush them off. They chalk it up to eye fatigue, assume they need a stronger prescription, or convince themselves it was just an odd glitch. But these visual disturbances aren't eye issues at all, they are brain issues. They indicate that arterial blood flow to the visual cortex or ocular vessels is being temporarily cut off. These short-lived disruptions in cerebral blood flow are technically known as transient ischemic attacks, or TIAs, often referred to as mini-strokes. A TIA is never a minor blip. A TIA is effectively a full dress rehearsal for a major stroke. Medical research confirms that the risk of suffering a full-blown stroke in the days right after a TIA jumps to between 10 and 15%, with the absolute highest danger zone occurring within the first 48 hours. So if you or anyone close to you experiences any sudden visual shift, even if it fades away completely within minutes, treat it as a top-level medical emergency. Don't wait around, don't wait to see if it recurs, and head straight to the emergency room or call 911 without delay. Closely linked to these vision disruptions, and often happening in tandem, are sudden bouts of dizziness, unsteadiness, or a sensation that your surroundings are spinning. The clinical term for this sensation is vertigo, and it carries very distinct traits that set it apart from basic lightheadedness caused by standing up too fast. Pre-stroke vertigo strikes suddenly and without warning. It's often paired with nausea or vomiting, doesn't fade when you sit or lie down, and frequently causes trouble walking straight, veering to one side, or an abrupt loss of motor coordination. This specific form of vertigo points directly to impaired circulation in the cerebellum, the brain region governing balance and movement, or the brainstem, which serves as the primary communication bridge between your brain and physical body. When the cerebellum or brainstem is starved of sufficient blood flow, your balance crumbles, motor control breaks down, and everything feels completely unstable. If you experience this alongside any other warning signs we're covering, please treat it as an immediate medical crisis. Now, I want to dedicate some time to what I regard as one of the most critical yet routinely overlooked pre-stroke signals: major sleep disruption. In the 72 hours before a stroke hits, an individual's sleep architecture and quality often shift dramatically. This isn't just basic restless insomnia. Patients report waking up repeatedly throughout the night, feeling their heart fluttering or racing upon waking, experiencing unusually vivid nightmares, sweating heavily in bed, and waking up feeling vastly more fatigued than when they first fell asleep. Other individuals begin snoring much more heavily than usual, or their partners notice brief pauses where they stop breathing altogether during sleep. This pattern of fractured rest points to multiple internal processes happening all at once. Your central nervous system is operating on high alert as the body fights to keep blood circulation steady. Stress markers like cortisol and adrenaline surge, and if your brain experiences brief drops in oxygen supply while you sleep, it triggers emergency survival responses that yank you out of deep rest before your body can execute restorative sleep functions. Sleep apnea, which is exceptionally widespread among adults past age 60, exponentially raises your overall stroke threat. And a sudden, sharp escalation in sleep apnea symptoms in the days right before a stroke is a trend I've observed time and time again. If your sleep patterns alter abruptly and severely without a clear explanation, if you're waking up constantly, sensing a racing heart at night, or feeling unusually winded in bed, I urge you to take those signs very seriously. Next, let's address something people almost never connect to stroke potential: sudden shifts in mood, emotional balance, and cognitive clarity. In the days leading up to a stroke event, many individuals become visibly more anxious, unusually short-tempered, or emotionally volatile. They might express an unexplainable sense of foreboding or impending doom, a quiet intuition that something is deeply wrong without knowing why. They may get confused by routine tasks, struggle to hold focus, lose the thread of simple conversations, or make minor mistakes they'd usually avoid. These cognitive and psychological changes occur because the brain is already enduring intermittent dips in blood supply prior to a major stroke event. The frontal cortex, which manages logic, emotional control, and executive processing, is uniquely vulnerable to these vascular shifts. Individuals going through these subtle signs rarely speak up because they don't associate mood swings with cardiovascular danger. They assume they're just stressed, overworked, or having a bad day. Family members and loved ones, please stay alert to sudden, unexplained behavioral or mental shifts in those you care for, as this can be one of the earliest indicators of a developing crisis. One of the most hallmark indicators of an impending stroke, and one that people recognize by name yet frequently downplay, is a TIA, or mini-stroke. I touched on this earlier, but we need to go deeper because understanding TIAs is vital for saving lives. A transient ischemic attack generates classic stroke symptoms that vanish entirely within 24 hours, and often in just a matter of minutes. An individual might suddenly lose the ability to speak clearly, knowing exactly what they want to communicate, but emitting garbled speech or drawing a complete blank on words. They might feel sudden weakness or numbness down one arm, leg, or half of their face, struggle to process spoken language, or lose vision in one eye, and then within minutes or a couple hours, every single symptom completely vanishes. Herein lies the real tragedy. Because the symptoms clear up, people convince themselves it was nothing to worry about. They rationalized that they were just exhausted, drank too much coffee, or experienced a strange temporary blip, so they skipped getting medical help. Then the major stroke strikes. Sometimes hours later, the next day, or 2 days down the road. If you or anyone near you shows any sudden neurological sign for even 60 seconds, even if it fully resolves, go to an emergency room right away. A TIA is a 5-alarm emergency. It is your final clear warning before a major catastrophic event. Now, let's focus directly on the physical symptoms that manifest in the heart itself, the ones felt right in the chest and body, because these represent critical pre-stroke signals that rarely get mentioned in stroke prevention discussions. In those 3 days leading up to an event, particularly for individuals with underlying AFib or heart disease, the heart often starts behaving in distinctly unusual ways. You might feel heart palpitations, a fluttering, racing, or pounding feeling in your chest that comes in waves. You might sense your heart skipping beats, marked by a sudden pause followed by a hard thump. You might feel persistent chest pressure or tightness that doesn't quite fit a standard heart attack profile, yet remains uncomfortable. Some describe a heightened awareness of their pulse, as if their heart is suddenly beating loudly in their consciousness. These physical sensations stem directly from cardiac rhythm disruptions and the heightened workload imposed on a struggling cardiovascular system. They are explicit warning calls from your heart that its electrical and mechanical functions are failing under stress. If you experience palpitations, irregular heart rhythms, chest pressure, or a sudden hyper-awareness of your heartbeat alongside any other signs on this list, seek emergency medical care immediately. Don't wait around for things to get worse. When dealing with the pre-stroke window, time is absolute everything. Another vital signal I must address is a sudden, unexplained spike in blood pressure. Many adults over 60 manage hypertension with daily prescriptions. However, during the 3 days preceding a stroke, blood pressure can surge dramatically, sometimes reaching levels far higher than what someone sees even with unmanaged hypertension. This occurs because as the arterial pathways supplying your brain narrow or face blockages, your body automatically drives up systemic blood pressure in a desperate bid to push blood past the bottleneck and keep brain tissue oxygenated. This compensatory pressure rise is your body's emergency attempt to safeguard the brain. However, it carries extreme danger, as severely elevated blood pressure can rupture fragile arterial walls and trigger a hemorrhagic stroke. If you check your blood pressure and notice it's far above your personal baseline, particularly if it climbs past 180 systolic or 120 diastolic, and especially if paired with any other warning signs we've covered, treat it as an immediate medical emergency. Do not simply swallow an extra blood pressure pill and wait around to see if it drops. Call emergency services right away. I also want to highlight a warning sign that's frequently missed in women and older adults. Sudden, unexplained nausea and vomiting with no clear gastrointestinal trigger. In the hours or days leading up to a stroke, some individuals experience abrupt waves of severe nausea, with or without actual vomiting. This discomfort has zero connection to dietary choices. It typically hits in waves, often paired with cold sweats or lightheadedness, leading people to mistake it for a basic stomach bug or food poisoning. However, this nausea often stems from rising intracranial pressure inside the skull as cerebral circulation shifts, or from the vagus nerve reacting to acute cardiovascular strain. The vagus nerve creates a direct link between your brainstem and digestive system. And when the brain endures vascular stress, vagal stimulation can trigger intense nausea. If you experience sudden, unexplained nausea, especially alongside dizziness, headaches, or neurological changes, do not simply blame it on your stomach. Now, let's explore what's occurring inside your arteries and blood vessels during the days leading up to a stroke. Grasping this process gives you a much deeper appreciation for why your body transmits these specific signals. In most ischemic strokes, the sequence leading to total vascular occlusion actually develops over several days or longer. Atherosclerotic plaques, the deposits of cholesterol, calcium, and inflammatory matter lining arterial walls, can become structurally unstable. When a plaque destabilizes, its outer cap can fissure or rupture, prompting your body to rapidly dispatch platelets and clotting factors to seal the breach. This cascade forms a localized clot, known as a thrombus, directly over the damaged plaque. If that thrombus expands to completely seal off the artery, a stroke occurs. But prior to total occlusion, before the full stroke takes place, microscopic pieces of the clot can detach and travel downstream into narrower brain vessels. These floating fragments trigger the temporary symptoms of a TIA. The clot hasn't fully closed the pathway yet, but the destructive process is actively underway, and without immediate medical intervention, it will almost certainly reach its endpoint. This is the vital window, the precise moment when a stroke can still be prevented, and identifying that window depends entirely on recognizing the warning signs I'm laying out for you today. Now, let's discuss the critical role that blood pressure prescriptions and other cardiac medications play during this pre-stroke phase, as this is a topic many of my patients and viewers frequently ask about. If you take blood pressure medications or blood thinners, it is vital that you adhere to your regimen strictly and never skip doses, especially if you notice any of the warning signs we've discussed. Skipping even a single dose of antihypertensive medication can trigger a dangerous rebound spike in blood pressure that sharply raises stroke potential. Likewise, stopping a prescribed blood thinner without direct physician guidance allows clots to develop that otherwise would have been prevented. I've encountered patients who felt generally unwell, experienced some of these pre-stroke warning signs, and made the mistake of skipping their daily meds because they felt too sick or exhausted. Please, never make that mistake. If you're dealing with unpleasant side effects from your prescriptions, contact your doctor, but do not make the risky choice to halt them on your own, especially when your body is actively displaying signs of cardiovascular distress. Let's now examine the key stroke risk factors specifically affecting adults over 60, because your risk profile changes substantially with age, and understanding your personal risk level is one of the most empowering steps you can take for your long-term health. Beyond age 55, every passing decade roughly doubles your likelihood of experiencing a stroke. The primary risk factors that accumulate in older adults start with hypertension, or chronic high blood pressure, which affects over 70% of individuals past age 65. Then there's atrial fibrillation, which impacts nearly 9% of adults over 65 and grows more common with each decade. Diabetes, which accelerates arterial hardening and blood vessel damage. Elevated LDL cholesterol paired with low HDL. A history of smoking, sedentary lifestyle, obesity, sleep apnea, and any previous history of TIA or stroke. If you carry 3 or more of these risk factors, your lifetime stroke risk is significant. And the warning signs I've detailed today aren't just theoretical concepts. They are life-saving knowledge you should memorize and share with your loved ones. Now, let's go over the immediate steps you should take right after watching this video. First, I want you to master the FAST acronym, because despite how frequently it's mentioned, studies show that most adults still can't accurately name all 4 components. F stands for face drooping, sudden weakness or numbness on one side of the face, or one side sagging when trying to smile. A stands for arm weakness, sudden loss of strength or numbness in one arm, or one arm drifting downward when raising both. S stands for speech difficulty, sudden slurring, difficulty retrieving basic words, or trouble comprehending speech. T stands for time to call 911. The moment you spot any of these signs, dial emergency services immediately. However, I want to expand beyond FAST, because clinical research reveals that FAST alone misses about 14% of strokes presenting with atypical symptoms. That's why we use the expanded acronym BFAST. B stands for balance, and E stands for eyes. If someone suddenly loses their physical balance without cause, or experiences sudden visual changes in one or both eyes, these represent critical stroke warning signs that demand an immediate emergency response. Let's quickly summarize everything we've gone over today, because I want these critical warnings firmly etched in your mind. During the 3 days prior to a stroke, your body may exhibit any combination of these warning signals. Profound, unexplained fatigue that differs from ordinary tiredness. Unusual headaches, particularly centered at the base of the skull. Fleeting vision shifts in one or both eyes, such as dimming, blurring, or partial loss of sight. Sudden vertigo or unsteadiness that doesn't go away with rest. and severe sleep disruptions, including night palpitations, cold sweats, and waking up entirely unrested. You may also notice sudden shifts in mood or mental clarity, including abrupt confusion, uncharacteristic irritability, or a lingering sense of foreboding. Brief TIA episodes whose symptoms clear up independently, such as slurred speech, arm weakness, facial drooping, or vision loss, even if lasting just a couple of minutes. Cardiac signs like palpitations, irregular heart rhythms, chest pressure, or a sudden hyper-awareness of your pulse. Sharp blood pressure spikes far above your normal range, and sudden, unexplained nausea paired with dizziness or sweating. A single symptom on its own might not definitively signal an impending stroke, but experiencing two or more of these signs together, or within a tight time frame, forms a dangerous pattern that demands immediate medical evaluation. Please do not wait around, please do not dismiss it, and please take action. I'm Dr. Eduardo Perez Alba, and this is my passion: taking complex, often frightening medical topics and breaking them down into clear, honest, and actionable guidance. If this video offered you value, taught you something new, or shifted how you view your health or the well-being of a loved one, please share it. Send it in your family group chat, forward it to a friend over 60, or post it on social media. Somewhere out there right now, someone's body is broadcasting these exact warning signs, and they have no idea what they mean. Sharing this video could reach them before it's too late. Subscribe to Leonid Kim Health if you want to continue receiving this straightforward, comprehensive health education. I release regular videos focusing on the topics that matter most to adults over 60. The crucial details your doctor might not have time to fully explain, and the things mainstream media often misses. I'll see you in the very next video. Take care of your heart and take care of your brain.